Welcome to the Heart Smart series. I'm Whitney Tate, and joining us today is Debbie Leoni, Director of Cardiovascular Outreach Services at SoutheastHEALTH. Today, we're going to talk about cardiovascular screenings offered by SoutheastHEALTH, what they're for, and who should get them. Thank you for joining us today.
Well, thank you for having me.
Debbie, let's start off by you telling us about the cardiovascular screenings that are available at SoutheastHEALTH.
All right, we actually have quite a few different ones that we offer at different times throughout the year. The one screening that's offered periodically is called Peripheral artery disease, PAD screening, and that is looking for any kinds of obstruction that to the legs that are the arterial circulation in the legs. So we offer those quite often as a free screening at our different clinics throughout the whole region. And the nice thing about that is those are for people who have either been long-term smokers or long-term diabetics in particular, people who've got discoloration, wounds that won't heal on their feet, things like that, where they are concerned that it may be something significant. So it's not a very difficult test. It's basically looking at the pressures in the lower body compared to the upper body and seeing if there's a big difference and that there may be some obstruction, in which case we would send them to our cardiology group and our cardiovascular groups in order to have follow-up for more extensive testing. So that's one of them that we do on a regular basis. We also do Lowdose CT screening for pulmonary and cardiac calcium score. So those are actually a CT. They have a small fee attached. And we do those 3 or 4 times a year because they're done actually at the hospital in imaging. And they have a CT of their heart and their lungs, and they're able to see for the calcium score if there is calcification within the arteries of the heart, which is a really great way to catch things early enough and do behavior modification, check your cholesterol, check your blood pressure, check your medications, all those kinds of things to make sure they don't progress. The low-dose CT for lungs is actually looking for nodules of numbers of them, sizes of them, and then those are followed up by our pulmonology folks. So it's really a good, really well worth the time to go. We usually do them on Saturdays throughout the season. So we do blood pressure screenings. We do vascular screenings where we work with a company that comes in and it's a carotid screening for stroke, AAA screening for an aortic aneurysm, as well as a PAD screening and osteoporosis screening. So those are offered several times per year as well. They also have a small fee attached, but again, they're followed up by Southeast Hospital staff and directed in whichever way they think is appropriate based on what they find.
Can you explain why the screenings are so important?
It's really important to have a baseline and catch things early. There needs to be opportunity to adapt and modify risk factors based on changing behaviors like smoking cessation, things like that. That can make a huge difference if you catch it early.
Do the screenings take the place of just regular doctor visits?
No. Screenings are meant to be an alert, an awareness. You have to keep up with your regular doctors in order to get really good follow-up care. They know your whole history. They look at not just one component of what we're doing, but they look at your whole history and what you've, other risk factors you may have and other disease issues you may have, and they put it all together.
Debbie, at what age should people start having the cardiovascular screenings?
Well, a lot of that depends on which ones we're looking at. Some of them, like the calcium score, that's not something you're going to find young in your life. Usually that you're talking about 35 or older with the risk factors who we ask to go to those kinds of screenings. We don't want to overexpose people to some of the testing. But some things like cholesterol, you need to have those done when you're an adolescent, so you have a baseline. There's people that have familial cholesterol issues that they need to identify and take care of really early. Other things like the low-dose CT for lung, those are for people 55 to 80 years old who have what we call 30 pack years of smoking, which means a pack a day for 30 years or 2 packs a day for 15 years, and they've been a smoker within the last 15 years. So each one kind of has its own criteria.
Debbie, can you talk a little bit about how the screenings can prevent diseases?
Absolutely. The biggest thing is identifying things early before they progress to a point that something really dramatic happens. So if you're doing a leg screening to see if there's arterial blockage, and the doctors can go in and modify risk factors, do the appropriate treatments, you're talking about everything all the way down to saving your leg. So it's critically important to check these things early, find out it, because sometimes there's a lot of things that can affect how your legs feel. So if you can eliminate that one, or follow up and get the risk factors modified, you're literally talking about saving your life or saving a limb. So it's really important to get this done early and get early intervention.
Can doing a screening reveal problems that need immediate attention?
Absolutely, absolutely. We've had, especially in the Lowdose CT for lungs, we're talking about finding nodules or multiple or by size that need immediate follow-up and attention. And that's part of what we do afterwards, is to talk to you about what it was found, how soon, because there's guidelines on how often people should be screened based on what's found. The calcium score, we follow up right away with cardiology to have them look at it again, evaluate with follow-up testing, because absolutely those things can progress, and if you ignore them, then you're really waiting for an opportunity for that to become a really bad outcome.
Debbie, what's the one most important thing you want people to remember about cardiovascular screenings?
I think the most important thing is that people get screened, they find some kind of an issue that needs follow-up, that they, in most cases, have risk factors they can modify to alleviate those concerns and to prevent long-term really bad outcomes. So if they quit smoking, if they watch their diets, if they keep their weight under control, if they get their cholesterol checked, they get the medications they need, and follow up regularly with their physician, they can alleviate a lot of the things that are identified early. If you wait too long, you literally are talking about things that can really have huge impact on your life and quality of life.
Is there anything else you'd like to add today?
Well, I think it's just the idea that we do have a lot of control over our health. We have a lot of control over how we eat and how we drink and whether or not we smoke. I mean, honestly, smoking has got such a huge impact on every organ and every part of our bodies that it has an impact on pretty much every condition. Regular interaction with a physician who knows you and knows your care and knows your history, really important. So the biggest thing is that we can take control just by being proactive.
Debbie, thank you so much for joining us today.
Thank you for having me.
For more information about this topic and others, visit SEHealth.org.